There's many factors that can contribute to snoring. Some of the issues are just the genetics. Just simple nasal congestion will cause snoring problems. Crowding teeth can cause snoring because there's no place for the tongue to fit in there. You know, we all think of obesity as being a big factor. Something as simple as the position that we sleep in. If we sleep on our side versus on our back, keeps the tongue from falling off and vibrating up against the back of the throat. There's some current studies out now that show that vibration can cause plaque buildup in our carotid artery. So the simple act of snoring, loud snoring, can create cardiovascular problems and stroke. Sleep disorder breathing can be simply snoring, but it can also go to a level where it's absolute stopping of breathing. That's called obstructive sleep apnea. It really is important to see a doctor, to look into it, to investigate it, because it's definitely correlated to strokes, heart attacks. It's linked to diabetes. It's linked to Alzheimer's, senility. In fact, oftentimes, I shouldn't say oftentimes, but there are cases of Alzheimer's that have been diagnosed as Alzheimer's when actually they're just a sleep disorder. Well, let's start with the granddaddy of them all, the treatment options. First of all, everybody thinks of the CPAP. That means constant pressure in your airway. And the CPAP is very, very effective. It's not 100% effective and has some risk factors that can be associated with it, but that's the granddaddy of them all. In 2006, the Academy of Sleep Medicine said that an oral appliance is a treatment option for people with mild to moderate sleep apnea. There's two types of lasers that have come into play with treating snoring and sleep apnea. One of them is an ablative laser. That's a laser that cuts and removes, and it's used sometimes to go back into the back of the throat and remove part of the soft palate. This laser is new technology, and as I understand, there's only 100 of us that are using this laser in the United States. This laser is a rejuvenating laser. So it changes the collagen that has gotten older, flabby, softer. In the back of our throat, that collagen is type 3 collagen. This laser beam, by shining on the tissue, warming the tissue, changes it from type 3 collagen back to type 2 collagen, and it causes other collagen to regenerate. This particular laser is very useful for us in the dental profession because we can have hand pieces on it that can actually remove decay. The hand piece that we use today to treat my patient, it uses a pulsed energy of laser beam. It's called an erbium YAG laser, and it penetrates very, very shallow, but it triggers the rejuvenation of those collagen fibers. What they can expect on that first visit is a treatment that's going to take 25 to 30 minutes. We have a particular route that we're going to cover in the back of the throat and on the little uvula that hangs there, and we just shine that light on it. That night when they get home, they may, a small percentage of patients say that the back of the throat felt a little scratchy or itchy, and when they wake up the next morning, probably 40 or 50% of my patients report that that night they felt like they slept better. That's what studies have shown by interviewing patients, and so the airway gets opened up that very first night. In most cases, it's going to take 3 sessions, 21 days apart. In rare cases, and once again, this is all about architecture, shape, thickness, flabbiness, might take 4, maybe 5 treatments with the laser. And a lot of people ask if it's a permanent treatment, and it's not. It's rejuvenating, and once we rejuvenate, we start to age again. So it really is going to be one of those things that the bed partner says, you're snoring again, get back over there and retreat that. I've treated a lot of people over the last 8 or 10 years with an oral appliance. I've seen a lot of people who are not able to wear a CPAP. I've seen a lot of people that have had surgery that's cut off parts of the back of their throat and then even had complications from that. But there's never been something as non-invasive as this laser that has, and this is reported, 80% success rate. That's the craziest success rate you can imagine. Even the CPAP is 40%, 50% maybe. So, non-invasive, rejuvenating, it's awesome.